Our teeth play an essential role in our everyday lives. They serve both functionally to bite and chew, and aesthetically when showing off that nice shiny smile. Also, if you don't take care of your teeth, cavities and unhealthy gums will make your mouth very sore. So let's take a look at what you can do to keep your teeth healthy with these proper brushing techniques. The first technique is the horizontal technique. It is done by moving the brush back and forth on the teeth in a scrubbing motion. It is the method that most people use to brush their teeth. However, it is not recommended because it is very abrasive to the gums, which can lead to gingival recession. This next one is the Phones method. It is done by moving the brush in a circular motion along clenched teeth. This is the technique that is taught to a young child and to those with very limited dexterity. Next up is the modified Stillman. In general, this is the most appropriate technique suitable for everyone and is highly recommended. This is accomplished by directing the bristles towards the gums at a 45-degree angle and placing the bristles partly on the teeth and partly on top of the gums. Next, vibrate the bristles with slight pressure to stimulate the gums. Then sweep towards the edge of the teeth. Repeat for the inside surface of the tooth. For the chewing surfaces, gently use a back and forth motion. Similar to the Stillman method is the Bass method. This is used for people with continuous receding gums. This method is identical to the Stillman method except for one modified step. When directing the bristles towards the gums at 45 degrees, instead of placing the bristles on top, you want to gently insert the bristles of the brush underneath the gums. The rest of the steps are the same. This final method is the Charters technique. This is not as commonly used and is for people with orthodontic and fixed prosthetic appliances. This method is also similar to the Stillman and Bass technique. However, the bristles are not directed towards the gums, but are instead directed 45 degrees towards the edge of the teeth. Our teeth play a very important role in our day-to-day living, and keeping them clean should be a daily priority. So remember to use these techniques to help aid in ensuring your teeth are healthy and your smile is shining.
Modified Bass technique of toothbrushing is used by patients that have good manual dexterity and limited gum recession. The brush is placed at a 45-degree angle onto the front surface of the teeth, with the bristles projecting into the pocket surrounding the tooth. A small circular motion is made with the bristles into the pocket. Then, the bristles are swept from the gum line to the biting surface of the tooth, brushing over the entire front surface. This technique is then completed on the inside surfaces of the teeth. The toothbrush is once again placed into the pocket at a 45-degree angle, completing small circles, then brushed from the gum line to the biting surface of the tooth.